refer to the interviewee, even as minister, she has no capacity in law to lift level 4 and 5 from the counties to the national government. It must be a legislation and an agreement between the two levels of government to transfer. So even her opinion here will be relevant. Mary Mase.
Thank you, Chairman. Dr. Deborah, I put it to you that for you to be able to realize your policy objectives, you must have adequate or sufficient financing. But when you look at the Ministry of Health, and especially health research, it remains significantly underfunded. And when you look at the budget of the ministry, there's notable dependency on donor funding, especially on research, disease control and management when it comes to control of malaria, HIV, AIDS, name them. My question to you, from your experience in the health space, what are the barriers to achieving optimal funding in health research? Secondly, there are a number of hospitals, if you are approved by Parliament, there are a number of hospitals across the country that have been built through World Bank funding, GOK, and have remained unoperationalized for a number of years. Beautiful structures. Case in point is in my constituency, Amukura. Beautiful structure. They are not been operationalized, no furniture, nothing. So if you are successful, please do an audit of all such hospitals across the country, ensure they have been operationalized so that there's value for money, and before you start building others or advise for others to be put up. I think that the last one, just a comment. Thank you.
Thank you, Honorable Mary, for the wonderful question. I have done a lot of facility assessment, right from the community-based organizations, various facilities at the different levels of care, and also at supporting various countries within the Eastern Southern Africa, as well as the Afro 47 member states supported by WHO. And I'm an advocate for facility assessment. We need to have good capacity, offer quality of care for our patients. And so that will be a top priority for me, to ensure that routine assessment is conducted, that our hospitals are offering quality services. Again, a digital platform would be good to ensure that we are also monitoring and looking at the processes. Yes. So regarding research, indeed, we need to have policies to support research and regulatory. We need to have a regulatory body to look into this. We need to work with the ethics board, among other boards, to ensure that this is aligned. And we have multiple partners who are willing to support in matters research. And so it will be open dialogue, consultation and discussion, and see who can join us to support in the agenda of health research, this being another activity that I wish to undertake.
Thank you, Mr. Speaker. Mr. Speaker, first and foremost, I wish to state that the nominee comes from my county, and especially Saboti. But that will not conflict my assessment of her capacity to serve in that ministry. And I am comfortable from where I sit of her competence, but what I'm worried is that the ministries, especially the Ministry of Health, is a theater of politics. And, you know, the previous minister also hailed from my Saboti constituency. I don't want a brain drain of my sisters coming to Nairobi and being swallowed by the politics of the town. how are we equipped in terms of interpersonal relations and the politics that goes around and the cabal of corrupt individuals around the ministries? How will you deal with it? Then secondly, the shift, NHIF transiting to SHA. I think a segment of it is called SHIF. Is it prudent? Why not revitalize the NHIF in terms of digitalization, prudent utilization of resources, instead of transiting, which means you could also transit corruption? Lastly, Speaker, it is my view that Kenya is ripe to be a medical tourist destination, just like Turkey, just like Malaysia, is a policy on tourism.
The biggest is India.
Yes, thank you. And now being a regional hegemony, you know, we can start with the region, not even beyond Africa, but just as a region. Do you believe that we are ripe to be a medical destination? If so, how? And if not, why?
Nominee?
Thank you, Honorable Member. And indeed, I love your last statement about having Kenya as a tourist destination. Having worked with the World Health Organization, Eastern Southern Africa, that covers the Eastern and Southern Africa region, it's actually based here in Nairobi. It's in the Kenyatta University Teaching and Referral Hospital. It is a regional office. And I have seen the tremendous things that have happened there. We've had expatriates come to stay here with the family, and that has increased. Our Kenyans have been employed through this. Tourism has also expanded, and also some of the products that they buy that are utilized in the office are being bought from Kenya. Equally, as they look into developing infrastructure, most of the time they're using local products. And if they also want to transport these health products, they can consider us. So first of all, I believe that we need to embrace regional partners, not just the country office, the country representatives, but regional partners such as the Africa Union, World Health Organization, among other partners, because they are bringing expertise from abroad, and these are the ones that will strengthen, build capacity, and also mobilize resources. Equally, we need to think about becoming centers of excellence in Kenya. This may not be achieved maybe this time, but it can be a long-term vision so that we capacitate our facilities. A lot has been done in the KU TRRH hospital, among other hospitals, and I think that is the momentum or the way to go in terms of building a capacity and becoming centers of excellence for Africa.
Just to, if you allow me, Honorable Speaker, on the question of medical tourism, yes. You've dwelt much on the aspect of expatriates coming into the country. India is one of the countries that receives the most number of patients who go to live there, stay in the hotels, use their, so it's a big beneficiary of medical tourism. Tanzania, across the border here, there's so many people from the coast who go to a hospital that is called Muhimbili or something. And many of them go there, and they benefit a lot in terms of revenue because of patients going out there. Kenya has just been sending away patients. It has not been receiving. In terms of policy framework and legislation, what would you propose if you are given this opportunity to develop Kenya as a medical tourism destination so that we can reap big in terms of our giving out medical services and also in terms of bringing revenue into, in the form of tourism in the country? What policy and legislative frameworks would you propose?
That you combine with Caleb and Mrs. question about medical tourism. Go ahead.
And the Speaker also, the transit from NHIF to SHIF or SHA.
Go ahead. Yes, Deborah, go ahead.
Okay. Thank you very much, honorable members. The first thing we need to do is assess and look at best practices from the other countries, such as India. What have they done in terms of building their capacity? And how can we improve? What are the timelines? What are the budget costs? In terms of specialists, we need to ensure that we have top-notch specialists in the areas, and also expand the medical equipment that can be utilized for this. And again, the infrastructure, the logistics, among other aspects that are involved. And so, yes, it is true that we need to have policies with regards to this, but in terms of how to progress, I think that we need to look at the priorities in Kenya. We don't have affordable, accessible, quality of care for patients. And I'll give an example. When I was in Fikiria Jamii, there was a widowed. She had 3 children. She used to wash clothes in Isili. And this lady had developed complications, and we had to send her to Kenyatta Hospital. And so we had to dig deep into our pockets to get money for her transport and her consultation. Once we did that, she went to Kenyatta Hospital, and an array of investigations, including invasive ones, were requested by the doctor, because they could have cost her an arm and a leg. And for treatment, it would cost her life, because she could not afford it. So coming back, I think we need to have our priorities right. And that is offering affordable, accessible care to all Kenyans, the vulnerable, the needy, the orphans, the widows, those who are unable to support themselves. And after that, we can think long-term of having Kenya as a medical hub.
Thank you, Honorable Speaker. Dr. Baraza, considering the recent reports of vaccine stockouts and the shift in policy regarding donor-funded programs, like those provided through Gavi, the Vaccine Alliance, what are your plans for ensuring sustainable financing and reliable procurement of vaccine and essential health products during your tenure as a Cabinet Secretary for Health? Another thing is about, and I think Honorable Kareb has asked you, it's regarding the transfer from NHIF to SHIF. To tell you the truth, majority of our people, they are not getting it, and they are not even registering. So I would like to hear from you, if you happen to get this chance, what are you going to do about it? Thank you.
Go ahead, nominee.
Thank you for those wonderful questions. And I will start with the last one, transfer from NHIF to SHIF. The service is to the people of Kenya. And so we need to engage them. They need to own it. They need to understand it. We need to embrace and have community feedback, and then work on it to see how we can intervene. And I believe that that was one of the challenges, that the community was not involved. We did not have robust communication with the community. I think it is critical for us to engage the community so that they understand the vision of SHIF, and they also contribute to see how this vision can come to fruition. Equally, it's important for us to involve the stakeholders, the counties, the county government, partners, among others, to make this come into fruition. So the dialogue is really critical when we are looking to transfer patients. and then we can come up with appropriate interventions. Regarding vaccine stock out, pooled procurement can be done amongst various countries, say for instance in Eastern African region. And then we can also consider talking to the Treasury and see if resources can be allocated, as well as discussing with partners in terms of supporting in the area of vaccine.
Mishimbogo. Honorable Mishimbogo.
Thank you, Honorable Chairman. Honorable Chairman, my first question, it is on the issue of the program dubbed as Linda Mama. This program used to facilitate free delivery by our expectant mother in this country. But right now it has been faced with quite a number of challenges, making women suffer, especially those who are expectant. I don't know if you're appointed, what mitigation measures are you going to put in place to ensure the Linda Mama program or a replica of Linda Mama program is enshrined so that our women will no longer suffer? My second question, it is about the rising mental health burden in this country, where some studies have shown that in every five people, one is suffering from health disorder. And this has been witnessed in our learning institution, especially in our universities, in our secondary schools, where we have seen love triangles cases, we have seen some suicide cases, some reckless killing, and so many other issues. And this issue is compounded by a fragile mental health system, socio-economic challenges, and cultural attitudes. Given the existing mental health policies and action plans, what are the key challenges facing the mental health system? If appointed, what policies will you put in place to address these challenges? That is, the immediate, the medium term, and the long term. And also, is the mental health integrated in the UHC? My last question, Honorable Speaker. No, I have the last one. This is last one. The other time I asked only one question, Honorable Chairman. I just want to ask the last question. Kenya right now has a deficit in terms of doctor-to-patient population. Now with the government directives, which frees new employment and term wage bill, what strategy are you going to ensure that we have more health provided, and especially for those dealing with chronic diseases such as cancers, because we have few oncologists. Also in the mental disorders, we have few psychiatrists. What are you going to ensure that at least we have more specialized doctors? Thank you.
You followed 3 questions. Linda Mama, will you bring it back in its same form or another? What do you do with mental patients and mental health care? Okay.
Yes, through you, Honorable Chair, I'd like to address the concerns. I am a beneficiary of Linda Mama, and my daughter is a beneficiary of Linda Mama. And so I'm an advocate of it. And I will ensure that it's incorporated if SHIF is rolled out. Now, during transition, the transition period, at times such activities may, fall through the cracks, but funds have been allocated from the discussions we were having while I was in WHO with the national team. So we need to have a transition plan or guidelines to ensure that some of these critical covers, like the Linda Mama, are always there when we are transitioning. So this is an area that we look to and ensure that all mothers and the children are covered. I will combine the mental health and doctors to patient population. Indeed, this is not just the doctors, but the health workforce in general. We need to look at how we can protect them and how they can grow in their career. And so I will engage the universities and other training programs such as the Eastern Southern College of Physicians, the surgical programs, the obstetrics and gynecology programs, and have deliberations on other programs that we can have in the country for our health workers to progress in their career, because we can have even clinical officers, nurses specializing in mental health, in matters oncology, among others. Equally, it is critical, again, as I said earlier, to strengthen community health programs and the primary care networks with mental health specialization, or professionals that have been trained in mental health. And so these are areas that we can look into addressing.
Sharia.
Thank you, Chairman. Dr. Deborah. KEMSA has been in the public domain for procurement irregularities affecting donor funds. What's your comment on that? If approved, what policies do you have in mind in safeguarding public resources and the management of KEMSA? Question number 2. Chapter 6 of the Constitution and the Leadership and Integrity Act 2011 imposes the highest standards of trust and integrity for state and public officers. And this is in relation to what my colleague was saying. How do you intend to address the public perception of the Ministry of Health as a mafia house associated with corruption and lack of accountability? What specific strategies will you employ to enhance transparency, restore public trust, and ensure that the ministry operates with the highest level of integrity?
Thank you, Honorable Member, for the wonderful question. And indeed, KEMSA has been in the public domain. What I intend to do, again, is to strengthen the processes and procedures, and that one of the areas is looking at the digital platform, as well as having external bodies conduct routine auditing. Again, visibility and accountability reforms, as well as engaging or a consultative approach to involve other sectors such as ESCC to look into these issues. We need to have transparent tenders, and I will hold my office with high integrity according to the laws.
Yes, Leader.
Thank you very much, Honorable Speaker. Dr. Deborah, a healthy nation is a wealthy nation. And I want to echo my colleagues what they have said. The health docket is a big docket. It's a very serious docket. And also is a docket with a lot of contestation and a lot of conflict. Having said that, almost 4 years ago, we sent many doctors to Cuba. And also Cuban doctors came to Kenya. We never had any feedback. I really want to hear from you what has been that feedback, whether positive or negative, and if there are any positive things, what is it that we have been able to borrow from the Cuban health system? My second question is, you have been a medical registrar at Kenyatta National Hospital. Across the road, you walk to Nairobi Hospital. In Kenyatta National Hospital, you have the largest Kenya Medical Training College in Eastern Central Africa. And also, you have the largest teaching hospital, university that trains doctors. When you compare the two facilities just across the road, in one you are in Europe, and in the other one you are in somewhere in Africa, not even in Nairobi. Just in case this committee is going to approve your nomination, what is it that you are likely to do so that we are able to see a better facility at Kenyatta? Finally, Honorable Speaker, there are memorandums that have been raised by Albert Gitonga, Henry Fundi, and two others about your practice status at the Kenya Medical Practitioners and Dentists Council. What have you got to say about that? Thank you, Honorable Chairman.
So, in terms of the feedback for the Cuban doctors, I have not been to the ministry. I'll be new to the ministry, and this will be a priority agenda. So I will review, and I'll be able to make a report and share with the Parliament. Regarding the training in the Kenyatta National Hospital and how to make our facilities better, routine facility assessments, identifying gaps, and coming up with international interventions to build up capacity is really critical. And I will be an advocate for that and ensure that we are conducting routine assessment. For my practicing license, I am a qualified doctor. My registration is A6275. I have been in clinical practice from 2007 to 2020, compliant to license renewal. In 2020, I joined World Health Organization. It is a UN, part of the UN agencies. It is an international, independent entity with no affiliation to any member states. I was an international civil servant, offering services to 22 countries in Eastern Southern Africa, and the 47 member states also supported in the Afro region. So my work and my capacity was at an international level as a policy advisor, giving strategic direction and technical advice to various countries in the Afro region. Once the president nominated me as cabinet secretary, because of the courtesy and respect and coming back into the Kenyan medical environment, as well as the office of the cabinet secretary, I renewed my clinical practice.
Mule.
Thank you very much, Chair, and welcome, Dr. Baraza, to this committee. Chair, I've pursued and I've looked at the CV of the Dr. Baraza. Having worked at Kenyatta Hospital as a registrar, Mata Hospital as a promotion, worked at Eastern Deanery as a physician and promoter, and then straight to WHO. I have no doubt on your experience, but I have a serious concern of where you are coming from and where you are getting into. And I think Cosin alluded to that. We want to hear you, how you will transit. Having been in the medical fraternity for the last 20 years, where you are coming from is where things are done as the policy of the institution. You are joining government whereby complex law, interest, politics carries the day. Madam, with all due respect, I believe you are getting into the Ministry of Health, whereby we have several departments, starting with the doctors themselves, starting with the nurses, the procurement agency, KEMSA, the programs, everything. I want to hear from you your management skill, or now you'll transit from that set mind of a straight line of thinking, and no wonder you are telling us every time consultation. Here, it is whereby the law applies. The law which is applied at KEMSA is not the same law which is applying with the doctors, enumeration and hiring. So, my question starts with, how do you tell Kenyans you'll streamline supply and demand of health communities in this country to the grassroots level, putting in mind we still have a devolved government? Secondly, from the international community where you are coming from, there are those policies and guidelines which are being given to this country. We must adhere to. One, Honorable Mukami talked about Gavi and vaccines. You know very well Gavi has been supporting this country for many years to provide vaccines and other commodities. But as a government, we have always delayed to pay these supplies, yet endangering the young newborns and the future of this nation by not being vaccinated and exposing them to diseases like polio. What is your take to how to progress on that? Thirdly, as a country, we are binded by all international commitments, starting with the United Nations Convention on on health policies. And I want to hear from you, how do we get out from donor-funded health programs in this country to a government-funded programs in this country on TB drugs, TB diagnostic tools, HIV drugs, HIV diagnostic tools, vaccinations and distribution of vaccinations to the country, malaria drugs and malaria transmission diagnostic tool. And last, how do you coerce the seamless working relationship between the Ministry of Health and the county government, putting in mind the largest budget within the ministry remains at the national government, and what is required to be transferred to the county government, it is transferred. And lastly, what policy are you going to use on relationship on working with the county government and the CECs at the county level to ensure that Kenyans does not suffer anymore for lack of health services in this country? Thank you.
Quite a mouthful. Can you answer that?
Thank you, Honorable Member.
Honorable Mule.
Honorable Mule, my sincere apologies for that. And indeed, I sense a lot of passion in matters health. And if hopefully given the opportunity, I believe we'll work together to address some of these pertinent issues. Yes, so again, this will be a priority in my agenda to understand the situation and come back with interventions, seeing that I will be new to the ministry. So the issue of supply and demand, again, we need to strengthen the information system. I think my mind has been focusing on that because I have seen it work. I have seen it work in various organizations that I have worked in. I have seen it being rolled out. I've seen the teething effects, but I have seen the impact it has had. It has reduced on costs, it has improved quality, and it has enabled people to track and see where their stockouts, among others. So we can be able to track the supply of commodities up to the last mile. Yeah? And then we can be able to also monitor other services. So I am an advocate of the digital platform because the human-to-human interface is what is bringing challenges, I believe, in our country at the moment, among other things. So for the vaccines and commodity delivery, yes, we need to allocate budgets to support this, and then we can have pooled procurement of vaccines. We'll also deliberate with the vaccine programs that are currently here, the vaccine production, and see on their effectiveness and their efficiency, and the cost implication. So, coming from my background, I know the concerns, the teething effects of vaccine production, and I know the members, the nominated committee wanted me to talk about vaccine production, but I think it is important that we go in depth and identify all these things before making commitment. In terms of health policy, for the dwindling donor funds, one of the areas we can consider is health insurance, but again, we need to have community ownership. The community need to embrace it because, you know, there are taxes involved. So we'll need to educate them and make them embrace it. With your support, with the county government support, the stakeholders, the partners, I believe we can make this successful. And equally, there are some programs which are again feeding into the universal health coverage, including maternal to child health programs, the TB programs, and so on. So we can see how to work as a team and synergize our efforts for improvement of services in Kenya.
As we sit here, the Kenyans who are watching, and they have been sending some SMSs to almost all of us. A few of them, they say, in case you are approved, embrace biotechnology and diagnosis, harmonize salaries of health workers. They earn different salaries while doing the same job. Somebody else says there's a program called Edu Afia for students. It was suspended because of fraud instead of punishing the fraud. Another one says advise her to solve UHC staff menace. They get only half salary for full work. Another one says Linda Mama must come back. That's what Mishi was saying. Another one says ensure SHIF covers ICU costs which are unaffordable by all Kenyans. Another one says, how will you handle monkeypox disease if you are confirmed? And you had answered that. Yes. Yes, Mule.
Chair, I didn't hear touch on the issue of diagnostic tools as recommended by the UN on the TB, HIV, and also supply of vaccines and drugs for malaria and the diagnostic tools for malaria. Please.
Yes, go ahead.
Yes.
The ones I've given here are just comments extracted from SMSs. Can you answer the members?
Thank you, Honorable Muli, for the question, and through you, Honorable Chair. Yes, this is an agenda that will also be priority in my list to be able to identify the situation and the gaps and the interventions therein. Regarding monkeypox, I'm happy to say that within this year, we've had multiple countries within the Afro region that have had monkeypox. And I have been part of the team that has been supporting the countries. And so I believe that this, with the support from the National Technical Working Group, we will be up to task to support the country to address monkeypox in terms of readiness and response in Kenya.
Daud, what was it?
Thank you, Mr. Speaker. I want to follow up what my colleague, Honorable Imase Mary, asked about facilities which have not been opened. A case in point would be even Meru, where there is a 5-story building which was done by Honorable Kiraito. He was the governor. 3 years down the road, it's never been opened, and there is congestion in Meru level 5. So there are many places like those. Do you think once you get in, you will say it is not national government, it is county government? what would your position be on those unopened facilities?
Take also from the Deputy Speaker.
Dr. Deborah, also some concerns that have been raised by members of the public who've sent me messages. They are saying that the community health promoters are being paid timely from the national government, but the contribution of the county governments comes in very late. I think they've been said that Isiolo County, they are currently on strike because they have not been paid. Nyamira County have not been paid for 9 months. So how will you ensure that the county governments are also able to make their payments as government does, national government does its contributions?
Thank you very much, Speaker. Dr. Deborah, just two quick questions. One, there has been worry of staff of NHIF transitioning to SHA or SHIF. They are worried about losing jobs. We have a law that is in place, but they're worried. What is your take on this? Are you going to transit all of them? Are you going to ensure all of them have jobs or others will lose jobs? This is a concern of NHIF staff. How do you respond to them? And secondly, what legislative proposals do you have to strengthen the health sector as you take over, if approved by this committee? Do you have any legislative proposal you want to make here? Because these are legislators and they would support your agenda. Do you have any legislative proposals going forward so that we can strengthen the health sector? Or what gaps are there in the law that you may want to fix to make health a better sector?
Thank you very much, Honorable Owen, and for the questions that have been raised. So I will start with Honorable Dawood's question regarding facilities and their capacity. It is critical for us to monitor the capacity of healthcare facilities to ensure that they are up and running and they are offering quality services. And so it is critical that we conduct routine assessment to identify gaps and come up with intervention. I hope to work together with the county government in terms of identifying the gaps and supporting, because healthcare, the health system is not just the infrastructure itself. It is the commodities, it is the services, it's the human resource. So we need to look at all those things and ensure that our healthcare facilities are up and running. And that is a task that I would wish to take up and in consultation with the counties. Again, the community health promoters, indeed, they are a critical component and a pillar for health service delivery. They are the ones who go to the community, supporting preventive, promotive, and rehabilitative activities. And so discussions with the county government on the gaps as to why they are not, the community health promoters are not receiving their money is really important, and it will again be part of my agenda. Regarding the NHIF, I'm still new to the ministry. I will need to review the HR capacity, the number of human resource that is required for the new insurance, but an intervention can be too much and move the HR, depending on their roles and responsibility, to the new area. So again, this is an agenda that we can have with the technocrats to see where the gaps are and how we can move the NHIF, because it is very sad when, you know, the sole provider of a family loses their job. And so this is something that we need to support our NHIF staff.
Saying that the law that was actually passed in Parliament on the social health insurance and social health authority says that they will all be assessed, and if you have the skill set for the new system, you will be taken. So there is no guarantee. Don't set yourself up. When you get there, you'll get into trouble that you promise you'll hire them. They will be all reassessed, and if they are suitable, yes. If they are not, they will not be taken, because it was said that in NHIF, there are some people even who are geologists, and yet they're working there, or nuclear scientists. So their skills don't match the work that they're doing.
Thank you, Honorable Chairman.
You will be the last.
Honorable Chairman, Kenyans have really been crying on the issue of public participation, and that there's so many decisions made in terms of Ministry of Health without their knowledge. My question to the nominee is, are you conversant with Article 232 of the Constitution on the values and principle of public service, and to what extent does your personal and work experience reflect these principles? I thank you, Honorable Chairman.
Yes, Majority Leader.
Thank you, Chairperson, Chairman.
Yes.
My last one, CS nominee. To me, you come across as a very young, diligent professional, but I have doubts in my mind. Will you be able to manage the cartels in Afia House? Because the home of cartels is Afia House. It was Christian Mafia House some time back. Do you have what it takes to fight the corruption cartels in Afia House, in NHIF, in KEMSA? Do you have what it takes?
Go ahead and answer.
Mr. Speaker,
Yes.
I think we also need to be fair to our time and the nominee. That question has been asked several times, so we can't keep on repeating the same. So I think honorable members must be attentive.
Speaker,
Yes.
Speaker,
Yes.
the question of the mafias and corruption was asked, but I think to be fair to the majority